Good afternoon, everybody. This is July 20th, and we'll have a special meeting of the Board of Supervisors. We'll be live streaming this today on our YouTube channel. And if I could get the clerk of the board to do a roll call to see who's on the telephone.
Supervisor Angus?
Here.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
And we have Supervisor Watson here and Chairman Bishop, so we have a quorum.
Okay, thank you very much. The first item and only item on the agenda will be a discussion with the County Public Health Director or her representative here today, Melissa Palmer, to update us on COVID-19, and we'll be taking any necessary actions based upon these updates. So Melissa, I'll turn this over to you.
Thank you. Our numbers have increased 170 cases since last period during the supervisor update on Thursday.
I can't hear.
Is your microphone on?
I'm not sure.
Is the green light on?
Okay, I'm on. I apologize. Good morning, or sorry, good afternoon now. There have been 178 cases reported since last Thursday's Board of Supervisor COVID update meeting. That brings us to a total of 2,262 cases to date. 108 deaths have resulted in the COVID cases. Bullhead City numbers, 1,069 cases reported to date. In Kingman, 454. Lake Havasu, 698. And North County, which encompasses Beaver Dam, Littlefield, and Colorado City, has had a case count of 41 to date. Average age of cases, 48 and a half years old, and then average age of deaths is 77.6 years old. The hospital status update was sent out this morning to the Board of Supervisors. Are there any questions from that email?
Does anyone have any questions? I don't see any, Melissa.
Okay. Testing availability update. Public Health continues to work with our community partners to increase community-based testing. We have had meetings with leadership in Bullhead City, Lake Havasu, and Kingman, and those will continue into this week. There will be community testing through a partnership with North Country Healthcare, July 24th and July 25th, 7:30 to 10 a.m. 100 tests per day will be ran, and pre-registration is required. It's through the Bullhead City software program. Staffing updates. Two? Okay. We have six case investigators that started with us today. They were part of new employee orientation, and they're going through training now. We have 2 additional case investigators that will be joining us, and that will bring us to 8 contact investigators. And just to review the case investigators, they contact new cases, gather their information and information on anybody who may have been a close contact, and follow up with that. Case monitors, which we have staff doing that role right now. They follow the cases and their close contacts during quarantine and isolation period. They provide support and resources during the time that they are under quarantine and isolation, ensuring they're maintaining their quarantine and isolation per the guidelines. And our case investigators, those who are 100% solely focused on case investigation, they have the potential of reaching 10 individuals per day, depending on how many are reached, how many we have good phone numbers or contact information for, and how many voicemails and follow-up calls have to be done. Are there any questions on that?
Does any of the supervisors have any questions?
I have a question, Madam Chair.
Go ahead.
How long is the training period?
I'm sorry, how long is the what period?
Training period?
The training period, so they will be doing the online portion of the training. today, tomorrow, and then Wednesday there's a live in-person. Well, we do it over the virtual, but it is we have an individual that does training with them, follow-up training. They'll be ready to go on Thursday.
Thank you.
Supervisor Angus, was that you trying to speak?
No.
Okay, there was some kind of interference. I thought it might be you, so. Okay, any other questions for Melissa? Supervisor Watson?
Thank you, Chairman. Melissa, when you recorded those folks that have recovered, how do you get that information? How is it reported by the patients, or how do you arrive at that number?
Yeah, I'm going to have our nursing services manager come up and speak to that particular item.
Thank you.
Currently, what we're doing is we pull up the cases in the statewide database, and if they've been released from isolation and from our monitoring of them, then they are considered recovered. And that's how I believe they are currently counting recovered for Mojave County.
So currently we have numbers for about a 25% recovered from the 2,000 and some odd cases.
As far as what our data shows, that could be possible, yes.
Okay, thank you. Thank you.
So, Ms. Valentine, there are most probably other cases that have recovered that we're just not aware of, right?
That is correct, yes.
Because obviously if they don't get worse, they recover. So we just don't have accurate counts or numbers for those, is that right?
I would say that's probably a fair assessment, yes.
Okay, thank you. Any other questions?
Hello? I actually have just a few.
Okay, Supervisor Angus, go ahead.
Okay, I'm still getting this question, and I know it's been answered by you and Ms. Furley, but if you can say it again in the record, hopefully it will get in the paper, because I get it every day. It is the question I get the most. Are people required to be retested? And if after they've been positive and to go back to work, I know some companies are, but are they counted again if they are positive?
Those individuals who are retested after the initial diagnosis, if they are tested again, they are not counted again.
Okay, I hope that gets in the newspaper because I keep getting asked it. Can we get better, more information? So in the beginning of all of this, we were told that the reason we couldn't get specific things like the exact age of people who died was because there was such a low number that they can be identified. Well, it's not such a low number anymore. I think I've always thought it was important that people know the exact ages, not just in a range. Can we do that? And if not, where is that mandate coming from that we're not allowed to do that?
Arizona Department of Health Services has some criteria that we have to follow due to patient protected information being traced back to a particular individual. So one of the biggest examples is if there was an auto accident and that information was provided through an entity, and then you see the obituary in the paper, then those people within the community, if they can connect the dots, then they would be able to clearly identify who that individual was.
We have no right to know who died for anything. I mean, no one, that is completely up to the patient. I mean, with deaths, I mean, they can understand some illnesses, but it's death. If I called the coroner, they would say the same thing.
It's my understanding that they would be, I can definitely double check for you with Arizona Department of Health Services.
What exactly for this public health emergency the rules are, because again, people are trading in some of their rights, but it seemed to me from day one that the people who are being protected most are the people who have died. And that just, it doesn't make sense to me. And if that's the case, you know, maybe we can get permission from, I just think it's important if we're asking people to give up their rights and their businesses that they get the best information to make decisions for themselves. Because right now, I think there's a lot of bad information out there. And I just think that it is our duty to get the right information out there. And to that point, is there any way I can get the number of deaths from other ailments during this period, let's say from March to August 1st, March 1st to August 1st, and similarly from 2018 and 2019? Because it's another question, people, like how is this comparing to a regular year? And what about all the people who are dying from other things? Is that matching up to the percentages from years gone by? Again, I think these are good questions. And I'm not trying to put more work on your department. My office will help with anything. I just need to know what we can and cannot get these answers to.
Supervisor Angus, do you have any particular ailments that you would like the information on?
This is what I'd like. How are the deaths this year in comparison with the deaths from the last 2 years, 2018 and 2019? But what about people who are dying from, you know, in an ordinarily flu season, we have people dying from the flu and from pneumonia, correct? Well, we're not hearing about that. How is that lining up? So I guess my point is everyone who's dying from pneumonia during the last 4 or 5 months, is that being counted as a COVID death?
I will state that the struggle with getting information on influenza and pneumonia-related deaths is they usually have comorbidities, so they have something else in addition to having pneumonia or influenza. If they end up with heart failure, it's often listed as heart failure. If they have respiratory failure, it's going to be listed as respiratory failure rather than...
That hasn't happened with COVID, though. That's not what we were told. We were told that the last thing diagnosed is what was going to be on the death certificate, and that's why there are so many people who had comorbidities that are now being, you know, designated as, like I know for a fact, I know from people I know, people in the process of dying from cancer, a day before they die, they're diagnosed with COVID, and then, so that's why I think the numbers are important, because here's the bottom line. People are not trusting the numbers, and not just from Mojave County, from everywhere. And if you're asking people to give up their lives, there has to be trust in the numbers. So I'm trying, and I know Mojave County is doing everything right. I do. So I'm trying to show that we are as transparent as possible, that public health is doing the very best they can. But it's hard when you say to people, we're not allowed to show you those numbers. So that's sort of what I'm getting at. I just think the more information we can put out, the better.
Okay, I will definitely do some research and see what I can pull up for you, Supervisor Angus.
You got it. Thank you so much for all you do.
Absolutely.
Madam
And,
Chair.
possibly Supervisor Angus, you might be able to get together with Denise Burley and have a sit-down meeting and figure out how much of this information she can give you and give you the statistics that you're desiring, rather than do it here at this meeting.
Okay, I will do that. Thank you.
Okay. And then there was someone else on the line. Go ahead.
Madam Chair, Supervisor Johnson.
Go ahead, Supervisor Johnson.
Supervisor Angus was asking, I believe, about the ages. Last time we changed the age groups on our own over the objections of our attorney. I would think that we could do the same again over the objections of our attorney by a board motion.
Did you have anything else, Supervisor Johnson?
No, ma'am. Thank you.
Okay, thank you.
Chairman Bishop, if I may. So has Supervisor Johnson then made a motion?
I did not hear a motion. Supervisor Johnson, did you make a motion?
No, I was just leaving that up to Supervisor Angus. It was her question if she wanted.
Got it. Okay.
All righty. Any other questions or comments or motions?
Chairman Bishop, I just wanted to answer. Thank you very much, Supervisor Johnson, and I'll take the next couple of days to, make sure that we do it absolutely correctly, and if I think we can, I will bring it back on Thursday.
Okay, duly noted. Okay, Melissa, do you have anything else?
I do not at this time, unless there are any further questions.
Okay, I have a question. I have a constituent that is concerned that people who need x-rays, MRIs, and other treatments are being delayed or having to wait with broken bones while they're in pain. She said she personally discovered that in her particular situation, there would be a 7-week wait for her to get an MRI at KRMC. She called WARMC and was able to get an appointment within a couple of days. I guess the question that she's asking is, could KRMC refer patients to other hospitals to cut down on the wait rather than to have the patient go hospital searching?
I was not aware of any delays related to this or related to a particular facility. We do have a phone call with those facilities tomorrow afternoon, and I will definitely ask the question on what are their wait times, what are they looking at, and what alternatives we can offer up to individuals who are seeking care.
Okay, thank you very much. Any other questions for Melissa?
I have some questions, Madam Chair.
Supervisor Johnson, go ahead.
I guess my first question has to do with the follow-up and the contact tracing. People are taking up to 7, sometimes 10 days to get their positive test results back. And I understand that some of these results go back to the doctor. And so it is slowing down the county in contacting the people to follow up, to see how they're doing, to get their information, to get their possible contacts. Can you expand on that? Is that what's happening, giving us a slowdown, and do we have any way we can possibly fix this?
Depending on the testing facility, we are seeing about 7 to 11 days of delay from the time the patient was tested until the time that we're getting the lab results. So that does create a delay, and it depends on which facility they go to, which lab that facility is utilizing to send their test samples to. As far as changing that, it depends on the volume. Some labs can take, 14,000 tests a day. Well, if they're taking tests across Arizona state as a whole, then that can fluctuate and it can increase that time of getting those results back.
What about the delay with the doctors getting us the information so that we can follow up, so we don't have that lag time of up to a week?
Can you speak to the physicians? I'm going to have our nursing services manager speak to that particular point.
So I have to say that most of our facilities and providers are very punctual with getting us the reports. As a rule, they are. I think probably the lag, a big part of the lag is also the sheer volume of test results that we're receiving. And, we're trying to do the best we can to follow up as soon as we can. But unfortunately, we've just become overrun with lab tests or with positive tests. And so there is a lag with us following up, not necessarily just because the provider hasn't gotten the test results back, but that's part of it. But it's also because of the volume and us trying to keep up.
I guess a follow-up to that would be then, too, obviously with the days we were getting 148 and pretty high numbers every day, and we've fallen behind, as we see with under investigation reports we get. Even with the 6 people that you're hiring who won't be on till Thursday, we're going to continue to fall farther behind. What's important to help you get a faster contact time with these people, because some of them are actually getting over the virus before we're able to catch them.
Correct. I'm sorry, I didn't understand I didn't hear the question. But yeah, I mean, from what I could understand, yes, that is part of the situation.
Okay, the part would be, what can we as a board do to help speed that up for you guys?
Supervisor Johnson, I can speak to that. So what we have looked at, we've done a mathematical breakdown of approximately how many individuals we can contact for the case investigation when we get a new case. With the 6 individuals that are joining our team, and we'll be starting a full day of investigations on Thursday, and then the 10 individuals that we have on staff now, we have, ideally, we could be doing 64 to 80 cases a day for case investigation. Ideally, if we were caught up 100% and we had contacted every single case that we have right now, that would set us up for being on top of things. However, because there is a little bit of lag there, that we're behind just a bit, then it's going to take probably a good couple of weeks to get caught up. If we had a couple of additional staff members, we could potentially get 100% caught up.
Okay. I would make a motion then to take money from the CARES to hire at least 2 additional people for the health department to do these contacts.
Madam Chair?
Supervisor Angus, go ahead.
I didn't hear where the money was going to come from, Supervisor Johnston.
From the CARES program?
Perfect. I'll second that then.
Okay, we have a motion and a second on the floor. Any further discussion? Hearing none, all those in favor say aye.
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 Any opposed? Okay, motion passes. Thank you.
Another question I had, Madam Chair, is can the health department explain the difference between the 2009 H1N1 pandemic and today's pandemic? We get a lot of people trying to compare the two and want to know why. In the H1N1, there was no mask, et cetera, and we're making such a big deal out of the COVID.
With H1N1 and also with Ebola, those illnesses, they showed symptoms pretty quickly, and they were severe symptoms. They were pretty ill initially. So we wouldn't have that time period of when somebody maybe was just starting to feel a little under the weather, wondering whether or not it's their quote-unquote allergies or something else that they were struggling with. And so they're still out and about and in the community during that time. And then they become very ill within days of that period. So that's one of the differences between COVID and Ebola H1N1. With H1N1, I looked up the cases, and there were 126 confirmed or possible cases of H1N1 since 2008, and that resulted in 1 death.
Thank you. Would it be possible on Mondays, when you give the number of recovered cases, if you could also include in your reports the average 7-day positivity rate for Mojave County? Would that be something that could be done?
Yes, I will definitely talk to staff about adding that.
And then I've noticed the last few weekends have resulted in low case numbers. Do you know why that is occurring?
It's my understanding that the 24/7 response that we have had beginning around March, April, it's no longer the 24/7 response. There are individuals that are taking time off. Some of the work hours that were being put in is being tapered back due to burnout and staffing. You can't run at 100% for this long without experiencing some sort of negative effects on your physical, mental, and social well-being. So it is my understanding that that is part of it.
Possibly my last question, can a perfectly healthy person die from the COVID-19?
There have been instances where individuals who did not have any other underlying health issues have succumbed to COVID-19. Not necessarily in Mojave County, but elsewhere.
Thank you, Assistant Director and Madam Chair.
Okay. Thank you, Supervisor Johnson. Does anyone else have any questions? Any comments before closing? Melissa, do you have anything else?
I do not have anything else other than have a safe and healthy day.
Okay, thank you. This meeting's adjourned.
Thank you.